medications, are you still taking the alprazolam?
Yeah.
Okay. And the ibuprofen?
Mhm.
And then is this other one the Gleevec?
Yeah, it's my chemo.
That's the chemo? Okay.
Yeah, Xanax and Gleevec and oxycodone are the three drugs that they make me take for chemo.
Oh, you take oxycodone too, or?
Yeah.
Okay.
When I want to stay away from it, I take ibuprofen.
Okay. Do you know what the dose is on the oxycodone?
30 milligram.
It's not with acetaminophen, is it?
No.
Straight?
So there's a relation between bone and blood cancers in Tylenol. So I told them to take it out.
Okay. Alright. You have an allergy to vancomycin?
Mm-hmm.
Alright. What's your pain score right now? You said it's about a 10. Okay. Now you just clip this one on your finger. Thank you.
This is weird. It says female right there on patient. Your patient.
And Aurora?
Yeah.
Oh, yeah, they entered it wrong.
Yeah.
Oh no.
I'll just say it didn't.
Wait a minute. No, they didn't. This isn't
It's because they're idiots.
patient.
That's what I mean. I don't
That's not you.
know.
Yep, this is not you.
Yeah, they're not very smart people. I know.
Oops, I'm sorry.
It's okay.
There you go. 98 and 69, I can take that, thank you. This stuff, this is not yours,
Yeah, I don't know what that is.
but this part's yours. So they clipped something up, the last page is not yours, is wrong.
They probably did something to cover their ass because they were terrified the whole thing was. They were treating me like shit, and I was calling them out on it every step of the way.
How much do you weigh?
160.
Okay, thank you. Alright, and then if I can get your blood pressure, is it okay to take it on the left? Which one would be better?
Okay.
Okay. I didn't know which one would be
Or
easier for you.
Off or.
Okay. Did your car get totaled?
And I'm pissed as hell too because it was my Forerunner that I loved.
What's that?
It was my Forerunner. And I love that thing. I was supposed to travel across the country with that.
Oh, wow.
And now I'm pissed.
$122/52.
What's that?
You're good.
I just don't understand how a hospital can be like, your face is broken and you need surgery and you have leukemia, so that's a lot of blood trauma from the neck up. Hit the road. I just don't get it.
What,
I wouldn't call it. I'd almost call that malpractice. I mean, I don't know if you could call it anything else.
yeah, that I'm not sure of, honestly, but, what happened with the accident?
Just dozed off for a second, regained control in the ditch, but because I was in a ditch, it's grass and there was a culvert and it sent me about 15 to 20 feet up.
Oh, no. Wow. Well, I know you're hurting and it probably could have been worse, but
I wish it would have been worse, because right now, everything that's happening right now,
yeah,
I'm
you got a
fine,
lot
I'm
going
done.
on. Yeah, you do got a lot going on. I'm gonna let Dr. Fleeman know you're here. She's probably looking over your scans, okay? And then she'll come in and see you shortly.
Okay.
Alright, thank you.
so it seems like we've been through a lot. Hey,
Quite a bit.
so
Oh, I don't know if this is.
fell asleep,
Any history of
rolled over.
Dr. Skopek, physical therapy,
That was, oh, he sent you for physical therapy?
a while ago. But
That was on this 2 months ago.
I just found it. I don't, or someone gave it to me. I didn't know how I found it, but you can throw it away or discard it if it's not needed.
Well, are you here for the shoulder pain?
I'm here for a lot of different things.
Okay.
I don't really know where to even begin.
Well, begin with the thing that bothers you the most. And I don't think it's feasible to cover everything, and you'll need to reschedule to cover everything, but unfortunately we are only given a limited amount of time. So, start with what is the most urgent? I mean, I see
Well,
facial fractures,
yeah,
I got report,
Broken nose, broken cheekbone, broken eye socket,
yes,
broken convergence bones right near the forehead.
yes,
That was all that.
yes.
Neck hurts really, really bad. They said they imaged it, didn't find anything. Don't believe it, because I know there's herniated discs all in the cervical spine. Don't know why it feels much worse.
Oh, dude, look at your face, you must have suffered trauma to the neck.
You should have seen it was like a garden hose coming out of my face with blood. I have the whole video of me being pulled out of the car just on my phone.
Mm-hmm.
And went to the ER and they're like, yeah, you need surgery to fix your nose right away.
Mm-hmm.
And then they discharged me with no clothes, no car, middle of bumfuck nowhere up in Wisconsin.
Mm-hmm.
And I was screwed from there. And I've been stuck trying to figure out my way to figure out what the hell even happened ever since.
Okay, so, this referral for shoulder pain was before this injury, so I
yeah.
don't think it's quite relevant. So, facial issues from here on, here's the thing,
Basically just here up.
it hurts. It hurts from here up,
It's the whole neck area, and then
okay,
like this upper area feels like a broken jaw in the upper jaw.
uh-huh,
Teeth are all loose and hurt. The nose is obviously broken, cheekbone's broken, eye socket's broken.
so, you really have to stabilize this area.
And he was gonna do it, and then he decided not to and discharged me without
Okay,
explanation.
well, moving forward, I can't do anything, I'm not an expert in facial bones, but when the bones in the eye can get fractured, you have a lot of nerves, you have muscles controlling your eye, and I can already tell that your kind of muscles move effectively, you don't have a lazy eye.
Well, this one was swollen for 2 days shut.
Mhm.
And,
No, but like right now,
there is a problem, because this eye will actually stay kind of shut sometimes.
Okay, and so exactly, that is a number one priority. So, anything when it comes to everything, do I think you injured your neck? Oh, I'm sure you injured your neck as well, okay? But are we gonna treat the neck by physical therapy?
I don't know.
Chiropractic, listen, we're not, and I bet you suffered a concussion, okay? You definitely suffered a concussion. You are gonna be,
all this up here too, and it just goes all the way up into here.
listen, you had a concussion. Maybe it's not a diagnosis here, but you definitely did. You suffer so much damage to the bones of the head. You have concussion, okay? Concussion will make it more difficult for you to concentrate, which is what you have to do with
I
all this
wouldn't call it
paperwork.
post-concussion syndrome or anything like that, no.
Well, we don't
Not
have
one
to
of
call it
those.
anything,
I
but
wouldn't
you
even call it
suffer.
concussion.
Okay,
I'm very aware of what's going on. I'm just very angry that nobody's doing anything properly about it.
what is the proper thing? What do you feel like needs to
They
be
should
done?
have corrected the broken bones right away.
What can
they,
I do for you today?
I don't know. I just came here because someone told me I had an appointment scheduled when I went to go see Skopek this morning.
Okay,
And I was like, oh, I guess that's today. And I just remembered, so I figured I'd bring this stuff along with.
I think you scheduled it initially for the shoulder.
Yeah.
That's when
There's
that was the
shoulder, the
referral.
abdomen, the back, the spine, the
Okay.
head, the neck.
Okay,
And now the neck is much worse.
okay. So let's do the following.
And it's not smart to be leaving trauma like this from the neck up just settling on its own when you're a leukemia patient with all that cancer blood up there. That's the dumbest thing you can do as a doctor.
Okay, so, gotta move on, you're here, what can I do for you today? Show me where the neck hurts the most.
I don't know if you can.
My hands are cold, sorry.
I don't know if you can feel that.
Yeah.
That's
Yeah.
a cervical disc popping in and out into the nerve. And there's a lot of that going up into here.
That's
The
your,
right side here.
you wouldn't be, look, this is your spinal,
And then back down to
look
the
at this.
thoracic and the
When
inner
you
cervical.
feel the neck, this is what you feel. Would you be able to feel the disc?
Yeah.
The disc is right there.
And still feel it if it's centrolaterally pumping out to the side like it shows up on MRI.
When it says centrolaterally, it's right here.
It's both. I mean, it would come out this way, or this way.
Okay, all right. So, how far down the arm does your pain go?
The whole arm.
The whole arm? All of left arm? Okay. Okay. What about the right?
Not so much, but
No.
my right shoulder's hurt from the accident, which I don't know what it is.
Okay, all right.
I told them at the hospital, they didn't
Take a
listen.
seat right here. All right. Don't recline for now. Bring the arms up. Okay, does it bother you?
Yeah.
Okay, go down. Go like this, bring them up.
How again?
To the sides. Up, 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 up. Okay, good. This way. Do your best. Okay. All right, stand up for me. You can relax your arms. Lean forward as far as you comfortably can. If you get lightheaded, let me know.
Yeah. Sometimes nosebleed.
Does this bother you?
Yeah.
Where?
All throughout my low back and my head.
Okay, stand up straight. Lean back. Does this bother you?
A little bit. Right at the top of the forehead.
Okay, take a seat. Put your chin down to your chest.
Oof, that's not a fun one to do. I can't do it.
Okay. What bothers you? The head, the neck,
All of it.
all of it. Lean your head back. Does this bother you?
Yes. Very much so right here.
Right there. Go to your side.
Left.
Left, right, we got two. We'll get to each one of it.
Ooh, Right
Side.
here. Very
Okay.
bad.
Go the other way.
Which is weird. I feel it down lower here, but not
Yeah.
up here.
Yeah, that's fine. Rotate again to the left. It's tighter here. You're not going as far.
Right
Okay.
here.
Yep. Okay. Go like
Not
this.
just
Go like this. Hold it strong. Let me check your strength. Are you right-handed or left-handed?
Right-handed.
Right-handed. Hold it strong. Good. Go like this. Hold it strong. Push me away. Push, push, push. Very good. Bring the wrists up.
like
Up
this,
to the ceiling.
like
To the
this.
ceiling. Up. Yep. Hold it strong.
This one has a problem. It may feel strong, but it has a problem. Like
Okay.
I can't go further this way because of that. Like
Uh-huh.
I can that.
Okay. Do you have any pain at the wrist?
Yes, a lot. Like right here, like right in this area, and then it comes down into there, usually from the shoulder and the arm.
Okay. So when does that pain start?
It's always there. It doesn't stop.
Okay. Okay. All right. At least it's strong for now. Spread out the fingers.
For now.
Hold it out. Hold it out. Okay. Put it down. Does this feel the same on both sides?
No,
How is it different?
can't feel this as much as I can feel that.
Okay. Does this feel the same?
No.
Different?
Mm-hmm.
Less here?
Mm-hmm.
Same? Go. Same or different?
Different.
Less here?
Yeah.
Same or different?
I can't really tell.
Okay. Same or different?
Different.
Different. Okay. Relax. Relax. Well, your spinal cord is not compressed based on your exam for now.
I was gonna say they did a spine exam and they found a lot of different areas where it was at my pain management clinic. Dr. Creevy.
Yeah, and so probably did an MRI?
No, they did an actual spinal exam. They went down each vertebrae and vibrated it, and
Mm-hmm.
actually read its, read some neurological feedback. I don't know what machine he was using, but I saw the readout, the diagram afterwards, and it looked like a spine like that, but then it was pointing lines out on each area where it showed that each of your discs were fucked up.
Okay, alright. Yeah, I'm not familiar with that mode of evaluation.
And he's a spine guy.
Mm-hmm.
He laid me down my stomach and just went over my back individually over each one. Hypersensitive. Can't really bend my left ankle up all the way.
Which one?
This one.
This one?
Yeah, it doesn't go
Is it
up
weak?
Yeah, and it doesn't come up all the way like this one does.
And since when?
I can't even remember, honestly. It's been so long, and I'm so tired of all of this.
Mm-hmm. And so when was the last time your lumbar spine? Because it seems like you've been kind of under the care.
It's been an issue since 2010, and nobody's doing anything.
Okay, well, I'm just seeing you in kind of, right now, let's treat kind of the most important thing. I mean, that's obviously an issue, but it seems like somebody is evaluating your spine. I mean, right now,
No, nobody is.
but you said somebody went over with a
No,
tissue, with some
The
device.
pain management guy a long time ago. There's a spine guy who was inside the pain management practitioner's office.
Okay, all right, and so left ankle weakness, and you're saying that's been for a while?
Yeah.
Okay. 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 No, okay. So, what are you on right now? Are you taking anything?
Just took some Xanax earlier this morning, and then I gotta take chemo right after this.
Who's your chemo doctor?
Me. It's just a pill I take every day. There's
So
no
chemotherapy?
Yeah, there's no interferon alpha with my chemo. There's no drip from an IV, it's a pill.
Okay. Do you have a doctor who treats your cancer though?
No, Medicaid scaring everyone away.
So who prescribed Gleevec?
See here, but I'm on my last month and they're saying that my pharmacy will no longer fill it,
Mm-hmm.
so
Mm-hmm.
I don't know what to do.
So, you have no oncologist?
Nope.
Okay, all right. So, but you have insurance right now?
Yeah.
Okay, all right. So all right. Here's the thing. Right now you have you have multiple chronic issues going on, and you have acute issue going on. Okay, so acute issue is that you recently underwent a lot of trauma, and anything you had before would be exacerbated, and so that's no surprise. But you also have acute trauma to the head and face, and that really is a priority, because if any of this moves or swells, actually at the base of your brain where the nose is, your being
That's what's worrying about me, because I'm feeling palpitations hitting up at the back of the brain blood barrier
okay.
by the thalamus.
Okay. All right.
And I remember that feeling because I told my doctor when I first started taking the chemo drug that's what was happening.
Okay.
And I told these docs at the hospital, I'm like, if you're gonna do something to fix this, fix it now.
Mhm.
Otherwise, you're gonna risk killing me, because too much blood from the neck up for someone who has leukemia can kill them.
Mhm. So, if you're experiencing these symptoms, you need to go to the emergency room. You need to be admitted.
Here's the thing. I've been to hospitals besides these guys, And aside from looking at the scans, they're like, we don't wanna look at the scans, and then they go talk to the doctor, and then
Mhm.
they're like, get out of here.
No, but, okay. So
So I
let
get the-
me go call emergency room and let's see if you can be admitted for all of the above, okay? So just be admitted by a hospitalist who will address the primary care doctor where they can evaluate things. And if you need a surgeon for the face, the surgeon is right there. Where you have multiple
Yeah.
x-rays to be done or MRIs, they can be done right there and proper treatment can be
I don't
done.
want x-rays, I just want MRI, I don't want radiation.
Okay, alright. So that
Radiation.
is something that needs to be addressed because stability of the face, the way you move it and everything is there. And literally, if it's not stable, that can kill you. And
I
while
was
we're
gonna say, you should see, I'm homeless, and I'm sleeping in a car, a rented car, and I have to sleep on like a headrest,
okay.
and like sometimes my nose gets messed up while I'm sleeping on the side, and that worries me when I wake up, because
Yeah.
my nose will bleed from that through the night.
Okay, alright. So let me call them because I think you need to be admitted, okay? There's too much going on and with so much injury that you had, it's unreasonable to expect you to recover in the car, okay? So stay put, okay? You can recline if you feel easier. Do you wanna recline right now? Go,
Actually, I kinda have to go to the bathroom,
go, okay,
but
go. Get,
no,
as long as you're comfortable. No, go ahead.
hospital, especially one out here. I got shit to do.
Here, okay, here's your disc, keep this, okay? I, looked at it, printed out the report. You need workup, you need to get some studies done, a lot more than I can tell you, oh, come back in a week once this gets scheduled, okay? This is not a way
That's
for
what
you
they
to
told
be,
me. They're like, come back in 2 weeks. I'm like,
come back where?
I know.
Exactly. It's, you need care, you need some TLC, you need this to be worked up, and you need to be monitored, because it can get bad real fast, okay? So, do you want us to, I mean, I'm not sure I want you to drive. I wanna call 911 for you here, so they transport you to the
I don't
hospital.
want to go to that hospital.
You gotta go
The
to,
hospital's bad.
there is no good,
And
perfect,
Advocate was worse than I thought NIMSI. I thought Advocate would be better, and they're worse than NIMSI.
there is no good hospital. Really, being in a hospital is bad to begin with, but here's the thing.
Being in a hospital in America is bad to begin with.
And you're right, and I'm not arguing, that's very reasonable of you to say that. Yet, they're not gonna let you die in any hospital, pretty much anywhere, okay?
They pretty much almost did it. I'm gonna walk in up in this Madison, Waukesha, whatever.
Okay? So, I'm gonna, have somebody and come pick you up, okay?
I can't do that.
What do? Do you wanna go there yourself? I spoke to Dr. Levitas, they're expecting
I don't know
you.
where that is.
I don't know either. He's a attending physician at ER that are expecting you. I don't know him personally either, but he knows about what happened,
Oh,
and
God,
he
I don't
knows
know.
the injuries. Who wants it? Well,
How would he know about what happened?
how do I know what happened? You tell them, you show them.
I never went there though.
That's okay, this is the first time I'm seeing this
I know,
either.
but I never went to NIMSI. How do they know about anything?
I just called them.
Oh, okay. I thought
Okay.
you meant like when you called them that they said that they already knew. I was like,
No, they don't know, but I told them, because this is something you need to be admitted for and monitored, okay?
I gotta get downtown to Chicago to talk to a lawyer regarding an insurance ticket, like. I
Really?
can't- Yeah.
What if you pass out and you die on the way there, okay? Basically, this is what I'm telling you to do as a guy who has some capacity to reason. I think it's important for you to get checked out first, that it's safe for you to be behind the wheel with the extent of trauma to the head that you suffered. Okay? And I will document it in my records that that's what I recommend, because I think that would be in your best interest. Okay? That's what I think you need. Now, if you disagree, again, I'm not gonna
No,
tie you
it's-
down.
It feels like that is kind of timing down, cause there's a lot of stuff that I had in motion already for today. That
Mhm.
this is stopping me from getting done.
Mm-hmm.
If I don't get this stuff done, then you seriously might as well just throw me back on the street.
Okay. It's up to you. I told them that that's what some of the things you need to be evaluated for, and they expect you to be there. If you don't show up, they can't evaluate you. Okay? So,
I just don't know when, like, I haven't showered in almost 2 weeks, like.
well, a hospital is a place where you can shower.
I can't.
You
It's
can't.
filthy there.
Okay.
I tried at the Aurora Summit, it was horrible.
Okay. All right. So, I think you need urgent care. I don't feel comfortable sending you outdoors to follow up the following day. Tell me what would you like to do.
I don't know.
Okay. Do you want
Cause I
to?
got no backup on this. I got nobody coming to my aid for any of this. I got nowhere to go.
Well, in the hospital, you can get social work to help you
No,
out
they
with
don't.
this.
They don't help.
I can offer you. I don't have anything else to offer you in this room.
I just don't wanna feel confined to having to go to an ER, which I've known nothing but
Okay.
bad experiences from.
Okay. All right. So, what would you like me to do? What can I do to help you?
I don't know.
Well, okay.
I just wanted to get an MRI to see if I was worse than this.
Well, I can't get you MRI today, and I don't feel you comfortable walking on the street with a brain injury and facial injuries like this.
Well, I've been doing it for a week.
That doesn't make it safe.
Well, if I try to get treated a week late, then my rental car gets taken away, and then I'm on foot stuck with recovering from surgery where? In a homeless shelter?
As a physician, I can only do so much, but in the hospital,
But I'm
you have
asking
some
you,
support.
That doesn't work.
There is
that
no
way.
good solution. I'm telling you, there is no good solution. I can't help you with everything. I wish I could.
I understand, but you're putting me in a position that makes me feel like I'm neglecting my own health when I have no choice.
It's your choice what to do, okay?
It doesn't feel like it.
I'm giving you my professional advice regarding your health. That's what my expertise is. What's the right thing to do overall in life? I don't think that's my
I
expertise.
mean, I can try and get back in later tonight.
It's up to you. But you need to be admitted.
I know, that's what I said after the accident, and they're like, no, even though we told you you needed surgery, we're, for no explanation, just gonna let you go.
Okay.
And
Alright.
that's just what they did.
Well, sit here for 5 minutes and think what you wanna do. I have to respect your choice, but I don't feel comfortable for you to drive, and I would suggest that an emergency room
Well,
picks
I
you up
have
and
nobody
takes you.
else who can take the car that I'm driving anywhere.
Okay. Then, I guess if you choose to drive, you can take yourself down. It's literally a 5-minute drive. If you gotta do it, do that, but I really need you to be seen, okay?
Okay.
Alright, so take a minute to think about it.